Thank you so much for having me here. It's been really a wonderful learning experience in terms of what is going on. Now, she didn't show me how to move this, but I guess it's just pushing a button. While I'm not in OB or pediatrics, I represent all of those groups within the National Medical Association. And my background has been so wide and varied that many of the discussions that we've had this morning, of course, really has impacted things that I've done from a public health standpoint and responding to disasters, certainly in terms of Ebola, Hurricane Andrews, and others that's there, and then a background in the military. And of course, because we talk about our future and the things that's going on, as president of the National Medical Association, one of the areas of focus for me is very much on health equity. And so when I had the call from Carla and my schedule was appropriate that I could be here, I really toyed with the idea of what really could I say to a group that really, you know all of this about infant mortality and maternal death rates and all of that, but maybe I could bring a little insight into some of those things, because two areas of importance for the National Medical Association, of course, is education and advocacy. And of course, we are going to celebrate our 125th year. And for those that don't know what the National Medical Association is, I always make the assumption, sure, they know about that. I don't have to give them much information. But let me just give you a little information about the organization. We were founded in 1895, and we're still standing. 5 physicians at the time. Of course, African-American physicians could not work in the major hospitals, and we were not allowed to become members of the American Medical Association. So these 5 physicians started the organization in Atlanta, and we've been around since then. We represent over 20,000 African-American healthcare providers, and of course all of the constituents that they see. We have 6 regions throughout the country, and we have 26 sections within the organization representing aerospace and military medicine, allergy, immunology, on through women's health. So we cover the spectrum of specialties. Of course, very much engaged in pediatrics, one of our large sections, and we have all of the subspecialties in that area, as well as OBGYN, family medicine, internal medicine. And so as an oncologist, I'm part of the internal medicine group, and so what I'm going to talk about, just about the health equity part, and as we look at our trends today in the United States, because things are changing so rapidly, is that unfortunately we are getting ready to raise a generation of children that are going to be sicker than we were. They're going to have a shorter lifespan. And so we are responsible for changing this trajectory and making it a reverse so that we can have a healthier set of children. And of course, when you start to look at the health of a nation, it's really based upon infant mortality and what we're doing, and you all know that. So just looking at some of the numbers there, I'll just capture on one of them. When we start to look at infant mortality rates in terms of black versus white, of course, you can see that it is much higher in the black population. So that last bullet is really important. We have to talk about improving our nutrition, hygiene, et cetera. And so this all impacts on the social determinants of health. And as Lourdes was talking about working with housing, I mean, social determinants, it's talking about us working together. I'll tell you a little bit about some of the things that I'm doing during my tenure as president of the National Medical Association in just a moment. But I want to mention one thing. We are here in the nation's capital, and we're having a crisis on infant mortality and maternal death rate. Our programs are ending. East of the river, and if you don't know how the city is divided, we have Ward 7 and 8, and the hospital there is closed down. It's prenatal care and OB section. where are the people going to go to get their prenatal care, to get the education and information that is needed. And other programs here in the city are closing down their OB program. And this is affecting the minority community to a greater extent. So I won't get political. I have that tendency sometimes to go in that direction. But let's just talk about minorities, and when we start to talk about the disparate share of morbidity, mortality, disabilities, and injuries, it impacts the minority populations much greater than the majority population. And I should say the National Medical Association joined with the Hispanic Medical Association, the Asian Pacific Islanders Association, and the Native American population, and we formed what is called the Minority Alliance, a physician alliance, and we are trying to address all of these issues throughout the country. And so, again, because we suffer in a greater extent, and I won't go through those data. You can see that not all states have the same mortality rates, and you can see it's higher generally in the southern areas. But again, there are a lot of rules that are coming out from this administration that's going to impact the care and the ability for those to receive services in certain of those states. I'm sure you've seen this in terms of the breastfeeding rate for racial and ethnic cohorts, so I won't spend a lot of time on this slide. Pushing back, just to look at again, when populations start to breastfeed, and it's really not about breastfeeding, but it's about the overall health care. And you can see when you look at the minority groups, whether you're talking about the Hispanic Americans or the African Americans, how those numbers are much greater. And it's looking at an age rate group that's on that particular slide. So when we talk about breastfeeding, and it's not just that you start to breastfeed, but it's important of how long you breastfeed is also critical. And so this is just some numbers here, and this is coming from CDC. You've probably seen that because I understand that was a presentation. And they have some targets in terms of 2020 of can we really get there? It's only a couple of years away. But so you really want to get to having breastfeeding for at least 6 months and then for a longer time period. But we are certainly not there yet. Some of the targets, of course, that should be instituted and really is there as a part of the 2020 is trying to get programs to set up lactation sites so that it's important for those mothers to be able to breastfeed in their workplace. And of course, I was so excited to hear that Senator Duckworth was able to breastfeed. And I guess that was something that she had passed just before she became a mother and had to use that service. And of course, the first time that that's ever happened in Congress. So we are making some steps forward. But again, we really need to increase that amount. And you can see in terms of the last bullet, the proportion of live births that occur in facilities where they recommend lactating to their mothers. That number is just outstandingly low. And we really need to change that if we're going to reach our goal of 2020 targets for breastfeeding. This is, again, looking at some of the numbers where you have the nearly 50% that are breastfeeding at 6 months, and then that number drops down significantly at 12 months. Looking at the targets that's set up for 2020, we have quite a ways to go to really get there and increase those numbers. And then when we start to look at it, as compared to African American women, those numbers are much, much lower. Some people say, well, why is that? And so I'll just go and pull up a little data that we have. Some of it may be cultural. Some of it was that we've been sold this bill of goods that it wasn't cool, you know, exposing your breasts and giving it to, you know, if you're part of the elite society, you don't want to have a child latching on and doing that. Oh, well. You know, that's something that your foreparents did way back when they had to be wet nurses. And so it's just not cool from a cultural standpoint and trying to move away from that. And so, of course, you had a lot from the formula industry. And I didn't say, I don't have any disclosures just want to make that statement known. I'm not related to any organization. I work for the National Medical Association, and this is just a labor of love, so of course I have no disclosures. But I wanted to say that a lot of the formula countries really marketed to the African American and other women that how it was so a part of the elite group for you to put your child on a formula rather than breastfeeding. And of course, what was missed is the importance and the significance of that breast milk and how important it is, because it provides some definite nutrients for those babies. And so there's also, I guess the National Geographic's had an article about how the natural microbes that the mothers then transfer to those children. And this is really important in developing the health of the baby so that they don't end up with irritable bowel syndrome and a whole list of other diseases down the line. And so, again, we bought into this whole thing about good mothering, and good mothering was one where you had to give your child a formula and not sort of have them latch on. Well, we're getting a generation that's beginning to change that and now come back to where it is perhaps a cool thing to breastfeed. But some of the things that we look at from a negative impact of breastfeeding is that if you're black, then that's not a cool thing, as I've indicated. And I'm sure my daughter and granddaughter will say, you don't say cool anymore. I don't know what the latest term is, so I'm going to say cool. I'm from that old school. It's just not cool. And if you're poor, if you're younger, and of course, if you're single and don't have that support. So while really, on the other hand, if you are in all of those categories, it's more important for you to give that child what is natural, what does not cost you anything, but having you to make sure that you're well nourished so that you can give those great nutrients to your child and bring up a healthy baby. That's really going to be important. So I think it's important also for us to talk a little bit more when we educate people about it's really empowering our women, our young women in particular, that it's increasing your self-worth, that you are doing something that's really going to be beneficial. And not only that, you have a connectedness with your child, so it's really going to be an important standpoint. And as I say, all of those health benefits is really also key. Because it's not just about the breastfeeding. It's about some of those social determinants are there. And again, this is some data that was just from breastfeeding and pediatrics that talk about a survey that was done on immunization, and it was looking at in 2012 the number of African American women who initiated breastfeeding, and we can see that the numbers are starting to go, but we are still not as high as the majority population at this point. But interestingly enough, in our Hispanic mothers, Latinos, it's really getting quite high and almost at the level for the majority population. Did I skip a slide here? Again, that was showing some of the gaps. When you look at the 2020 targets, they talk about at 6 months and at 12 months and beyond. And again, when you can initiate that in the African American population, it really tends to drop off when they move beyond that 6-month time period to the 12-month area. And you can see the numbers there. The role of breastfeeding, it really is important in terms of minimizing stress, because it's good mental health when you have that warm relationship and you're able to relate to your child and have that connectedness, in addition to the major health benefits in terms of diseases. And there's been a study to show that children that are breastfed have a higher IQ than some of those that don't. Again, that data may have to be looked at very carefully, but again, that would be a positive benefit as well. And of course, as I say, really that bond of warmth and connectedness that you have with your child, and that child then going out and having a close relationship in the community. This is a slide here from the American College of Oncology just showing the benefit not only to the mother but also to the baby. And you can certainly take a look at that, but there is a relationship in terms of minimizing the outcome from some of our chronic diseases, such as diabetes and hypertension, as well as cancer and cardiovascular disease. So I can get on my soapbox now and talk about what we need to do. Really, it's about policies. Policies and programs. And I think in our first slide, when we talked about the public-private partnerships, really, really important that we work together in the community with our providers, with our patients, with industry and agencies and government that's really going to bring about a good relationship in developing policies and programs that's going to increase and understand the impact and importance of breastfeeding to strengthen our communities as we go along. And part of that, getting the word out, is partnering with agencies and partnerships. And what I wanted to talk about that I have been doing with the National Medical Association this year, one of the things that I've talked about is creating a national action plan for health equity. And what that is a collaborative program where we're bringing all of the players back to the table to work together, because we continue to operate in our silos. We have medicine over here and dentistry over there and legal and nursing, and we're all one. And if we really are going to make an impact on the social determinants of health and bring about health equity, we all have to work together. And whether that is nurses and doctors and dentists and pharmacists and social workers and housing and transportation and faith-based organization, advocacy organization, men and women, all genders, all coming together to address the issues that's really going to minimize our social determinants. And that's whether it's peer group working together. And so during this program year at the NMA, I have brought all of those people together. I had to do it sort of in 3 phases. And the first phase was that I brought in all of the professional organizations as well as the disease associations, such as Heart Disease and Cancer Society and Diabetes Association. And we started to look at and talk about ways that we could work together to bring about health equity, because one size does not fit all, and we have to then bring that up. They bought into working together, and we moved forward. And then at the colloquium, we had to talk to our policymakers. So we had to bring in our state, local, and national legislators, because sometimes you make rules, and if they don't apply in your state, nationally, even though we are the United States, we still operate state-wise. And so we brought all of the legislators together. We brought the advocacy organizations. We had representation from the National Urban League, the National Association for the Advancement of Colored People. We brought our faith-based groups all to the table to saying, yes, this is important that we work together, because, again, we know that we have so many things that are going on in this country today that's really keeping us at the same level that we've been for the past 15 years, where you talk about health disparities. And so now we want to talk about health equity and make a change. And we can do that if we all work together. So they bought into that, and then it's certainly much more than access to care, but that's one of the things there you have to focus on, as I said, those social determinants, and we can bring in all of the environmental impact. We saw, again, in Lourdes' slides about how things are changing in terms of global warming and our weather. So many environmental issues that are there and policies that are having an impact to decrease and remove it. And again, we have to think about coming back together to bring that in. And this is certainly welcome others to come in and join us on this national action plan to bring about a change and getting health equity for all of our people. I don't know what I did. And this is probably one of my last couple of slides here. Because we operate in this area where we, as a healthcare provider, really have to concern ourselves, not just about putting that Band-Aid on that cancer or just keeping that person well for the next day. We really need to go back to focus on prevention. That's really what this is all about. And somebody said many years ago that ounce of prevention is a pound of cure. I mean, I've forgotten now what the statement is, but again, it is focusing on prevention, and we really need to do that. And we can do that as new technologies that we have, and we heard from our first speaker about a fantastic technology, and again, need to look at having that put into the community. And I think I was mentioning to someone, we said, maybe the next year we're just going to put a chip in everybody's arm and you just have your own health record, and we can then move on to say, this is what you really need to do, this is what you didn't get, and we're really going to focus on that preventive effort. And you can see that if we're going to bring about a change and come up with a new paradigm of our culture of health, the time to do that is now. And so that's why my theme is the urgency of now. And if you live in the United States or Puerto Rico, that really rings true. So we have to create that culture of health equity and overcome many of the negative things that are going on right now in this administration. Because, and I have a few recommendations, but we have to give our children a healthy start if we're going to look for that future healthy generation of children to come. And it's going to be about their social advantages as well as disadvantages. And there are several things that's going on with our children that we haven't paid close attention to that we really need to focus on if we're going to bring about a change. Final piece, the National Medical Association OBGYN section, probably along with our pediatric section, started this NMA Breastfeeding Alliance a couple of years ago. And of course, they received a grant from Kellogg, and they have been working on symposium. They've developed toolkits, and they have posters, and really getting out there, educating individuals about breastfeeding and the importance of that. One of the groups of individuals that I did mention that's really critical is a doula. I know many people know about doulas, but we have not given them the importance that they have, because in some communities they just don't have access to the kind of providers that's necessary. And a doula is a trained individual that can show those young mothers how to breastfeed, how to latch on, and it really is a godsend for some individuals that don't have the major health insurance and can't get access to that provider. And we might need to have that in Washington, D.C. if we're continuing to get a decrease in our OB care that's in this particular community. And so this is, again, another one of those areas that the National Medical Association is focusing on. Again, this is our future. We have to work on getting it there, keeping them healthy, getting those public-private partnerships together, getting good nutrition, smoke-free environment, and really focus on prevention. So if we are going to ensure that every child, and that means every child, should have a safe environment that they live in, they should have access to quality health care, very importantly, to have good nutrition and a quality education if we're going to have a future generation that's going to look out for this country and move us to the future. Thank you.
If you have some questions, line up at the mic. We do have time for a few questions before we have our last presentation before lunch. Is that a question coming? That's a question coming. Greg, just introduce yourself.
Altrina Mukuria with the Spring Project Save the Children. And all of my experience has been in global nutrition and health of infants and mothers. And more recently, I've been learning more about the domestic concerns. And I really appreciate you bringing up the disparities within the African American community as well as other communities in terms of our breastfeeding rates and some of the reasons why. And I was wondering if trauma is not part of the reason why African American women are not breastfeeding at higher rates. The trauma of racism and violence in our communities that people are responding to may be impacting their decision-making and ability to breastfeed.
Well, certainly trauma plays a part, but I think it really relates to the stress of the traumatic experience that they may have had or may have gone through that keeps them away from getting close. I think it's also some of that fear of getting into your little degree of private space. And so if you've been traumatized, you tend to want to be protective and stay isolated. And so that impacts, again, on the ability to breastfeed. And sometimes there was I guess it was a New York Times article about the young lady who was in that sort of domestic violence situation, and she was pregnant, and then she lost her health insurance, and she really couldn't get care, and ultimately, because she had suffered some trauma, lost that baby, and she then really became very much introverted and closed in, and it was on her third pregnancy, I guess, she then met a doula that helped her to find shelter in a different place so that she didn't have to go through that trauma. And with a lot of group therapy, she was beginning to get over that and to do better, but was, again, really wanting to breastfeed her child and to bond, and that actually helped her in that situation of getting over the traumatic experiences that she had had. So, yes, I do think trauma plays an important part. Thank you.
Hi, thank you for your presentation. Thank you for being here. My name is Lori Winter, and I'm here wearing the hat as the physician lead for the CHAMPS project, but I'm also chair-elect for the section on breastfeeding for the American Academy of Pediatrics. And so with that hat on, I wanted to know what you are learning, or what have you learned from your NMA membership, as we have begun to learn from AAP membership about the physicians' experiences and challenges with breastfeeding. And I wonder if it's similar to our experiences, you know, where young physicians are equally challenged, and you represent all different specialties, and I just wonder what you've learned from the membership.
Yes, I can say from some of the pediatric members that I've spoken to, and of course we have representatives at ABM, many of them really spend a little bit more time with their patients in terms of those that want to breastfeed but may have some fear, those that say they don't latch on well and it's uncomfortable. And so spending some time going through the process and observing those patients as they try to go through the breastfeeding, and working with them, working with their OB counterparts, and really helping them through that whole pre-delivery, postpartum area, and working with their patients. And that's some of the comments, but I'm sure Dr. Young may be able to have some of the
maybe
comments.
I wasn't clear. I was thinking more about the physician mothers, the physicians as mothers, and what the physician parents' experiences have
well,
been.
that's
so I think I wasn't clear.
Yes, so of course you do have the physician mothers that are there, and I can't say in terms of the numbers that have talked about breastfeeding, and certainly we would have areas for them in any of our meetings for them to go through a lactation area so that they could then deal with that. But again, even in the public spaces, we don't frown upon that. But again, I have not yet spoken to some of the younger ones that have had babies in the pediatrics or OB section.
Thanks for your talk, and thank you also for the focus of your presidency. Wish you all the success in it.
Thank you.
I wonder if you talk just a few
Would you
moments.
introduce yourself, please?
Oh, sorry, Chad EBrush, Executive Director at City Match. I wondered if you'd talk just a few minutes about the importance of addressing the role of racism head-on in this work around health equity. I wonder if it's particularly important at this time to avoid placing blame on either individuals or culture, and instead acknowledging the role that racism plays in driving decision-making.
That is a major, major problem, and I'm grappling with how to structure my plenary session at the upcoming convention in Orlando. Racism comes in many forms. It's, you can look at institutional racism, you can look at structural racism, you can look at racism in this country, and I'm going to just, since you opened that keg of worms. Oops, excuse me, I'm sorry, I turned myself off. It is difficult to be black in America. What that means is, and it's particularly stressful for a black male, when you look at Sterling Brown, the football player, a basketball player that parked his car across the line, and the police comes out and says to him, take your hands out of your pocket, and he's asking what's going on. Then it's reported as he was aggressive, standing, saying, what did I do? I parked across the two lines. Yes, is that aggressive behavior? It's aggressive behavior because he's a black male and he's 6 foot whatever. You then have a young lady at Yale University in her dormitory who happens to fall asleep because she's studying. A non-African American person calls not only the campus police, but the city police for Yale New Haven, who then demands that she show an ID. Tell me, what is it that just because my skin is different than yours makes me aggressive, makes me a threat? How, I mean, that's stressful in terms of day-to-day living, whether I'm in an urban area or whether I'm in a, and those were just a couple of examples. I can give you others. I mean, it goes on and on and on. James Blake, a famous tennis player, standing, waiting for his limo to pick him up in New York City, gets rushed over, tackled to the ground, and arrested because you look like somebody, and when they show him the picture, he looked nothing like him, but we all look alike, you know, so of course. And this is a person that he's on TV all the time. I mean, he's won all these championships. He plays tennis, New York. It's U.S. Open time. You expect to see tennis players. So that is a kind of racism. And for me, I think some of the things are learned behavior. And because we have an administration that really espouses white supremacists, for those individuals that have been a little afraid of stepping outside of that square, now they have been given carte blanche to just do whatever you want. So you have, and I'm not against police officers. I think police officers have some training that they need because some of them are fearful. And if you get into a profession where you are going to be afraid of any citizen that you approach, then you need to get out of that profession or you need to go through some additional training. And I didn't even bring up Starbucks and Waffle House and, you know, it's too much. To me, it's almost like reversing the history of this country back to the days when black people were lynched at will. Coming from the state of Mississippi, there's a book called Sundown Town, and it talked about how black people couldn't walk along the street or do other things, and they were lynched. It's almost like we're becoming to sundown America. It's frightening, it's stressful, and I don't know the answer, but I think we all need to get to the table to work together to bring about a change. Thank you. Sorry, I had to get on that.